Hi, Dan. Welcome to the podcast. Thanks
Thank
for
you.
being here. So, why don't we start off by just telling our audience a little bit about your role at Eurofins and what you do for us?
Sure. Um, my role at Eurofins is a staff scientist. I'm associated with the fat soluble vitamin group, and I feel like I have the best job in the building. Eurofins is very good at investing at the best platforms, the best instruments on the planet, and someone has to learn how to use them and utilize them, and that is me. So every day is like Christmas for me. Many of the newer methods that have been developed in the vitamins group are my creations, and I'm very proud of that. So I do like my job. I've been doing this role for over 30 years, almost as long as I've been married.
Ah,
I've been doing this longer than I've been married.
that's awesome, Dan. All right. So, you've kind of teased it a little bit there. You work for our vitamins group. So, why don't
Mhm.
we start off just very basic? What are vitamins?
Oh, sure. Oh, how much time do you have?
Yeah,
I
that's a
could
good point.
really take a lot of time explaining this. Some people devote their careers, their
Yep.
lives to the study of vitamins. Maybe I can start just by giving some examples in a roundabout way
Hmm.
from history,
Sure.
the way that vitamins were described and discovered. Let's go to about 3,000 years ago. The ancient Sumerians. Want to hear a crazy story?
Yeah, absolutely.
The ancient Sumerians found that they could cure cases of night blindness by
Hmm.
squeezing the liver juices onto the eyeballs of people afflicted with it.
Oh, my goodness.
Isn't that amazing? Now it sounds crazy, but there's a method to the madness.
Yeah.
The liver is a repository for retinol,
Yeah.
and retinol important in the vision cycle. So they didn't know what was causing it. They just knew even a person who was otherwise healthy, if they had night blindness, they found this obscure cure. Another example, scurvy. I think we all know what scurvy is. It's estimated that in the age of sail, 1500, 1600,
Mm-hmm.
1700s, 50% of the sailors died. And it was just because they did not have a varied diet. The first medical scientific study was done on the discovery of ascorbic acid,
Yep.
vitamin C, by examining the diets of sailors and doing selective removals of certain foods. Another one, beriberi, that is a
Hmm.
thiamine deficiency, horrible disease. Beriberi loosely translate to I can't,
Yes.
because people could not stand up, they could not move. Horrible disease. Rickets, widely spread, even in the United States in the 1800s, deficiency of vitamin D, creating weak bones, bent bones. So all these are vitamin deficiencies. The scientists of the late 1800s, early 1900s began to do investigations into this. I have to call out my alma mater, University of Wisconsin.
Yep.
We did a lot of the work. By doing targeted feed studies on cattle,
Hmm.
they found that cows eating certain specific feeds did not do well as others. From there, they extrapolated that there were two classes of unknown compounds. They named them A and B.
Hmm.
That's where our current naming of vitamins comes from.
Okay.
Vitamin A, fat soluble, vitamin B, water soluble. That's how that broke down. Then the name vitamin itself is an amalgam of vital amine. Early on, the belief was all vitamins were amines. It turned out that that's not true. However, the name still stuck. So anyway, in a roundabout way, back to the definition of the vitamins, it's a micronutrient,
Hmm.
which means it differs from a macronutrient being a protein, a fat, a carbohydrate. They exist in quite low levels, usually part per billion or part per million levels.
Hmm.
They have to be derived from the diet in a mammal. They cannot be produced internally. Um, and there are several. As I mentioned, there are the fat soluble and the water soluble. That is what a vitamin is.
So, Dan, specifically in relation to infant formula, why is the analysis of vitamins so important?
Oh, it's hugely important. The reason being is if the baby does not receive enough of the vitamin, it can have horrible physiological consequences. But in the same hand, if there's an overabundance because of a dosing error, because if there's a formulation error, it can also be devastating. The K vitamins and the D vitamins can be quite toxic if they're over supplemented. From my own experience, when my now grown sons were babies, I would routinely travel to the warehouse store to get cases of infant formula. That is all that the babies would eat. So you have these babies with a very restricted diet.
Mhm.
There's only one source of nutrition, and if there's an error in the supplementation of the vitamin, it would be devastating. Again, this doesn't really happen in infant formula because of the testing that we do, but in animal feed, it has not been unheard of that entire flocks of animals would be killed because of an overabundance of vitamins, especially D and K, in their feeds.
Yeah, so super important. Obviously, we'd never want that to happen to our babies.
No.
So, why don't you explain to us a little bit about the typical laboratory techniques that are
Oh, sure,
used
sure,
for
sure.
analysis of vitamins and infant
I
formula?
think much like the first question, again, this could take a long time to
That's
answer,
okay.
but let's do some history on this one
Yeah,
because it is
sure.
fascinating.
Absolutely.
I think I mentioned in the first question that at my alma mater, University of Wisconsin, they did feed studies with
Hmm.
cattle. Okay, cattle are of course quite large, and
Yes.
they eat a lot.
Yeah.
The researchers found they were kind of cumbersome to work with, so they chose to do the same studies with rats.
Hmm.
Okay, that was actually the first time rats were used in medical studies, if you will, at the University of Wisconsin. A long story how that came to be as well. From there, they found that they could also interpret vitamin levels by using bacteria.
Hmm.
If you have a bacteria that is specifically designed to digest and metabolize a vitamin, you can predict the growth curves in the vitamin broth by observing the growth rates, the plate counts that you see. If I can back up really quick to the rats, an interesting test was developed at the University of Wisconsin for the analysis of vitamin D.
Hmm.
Imagine this: you take a group of rats, we deprive them of vitamin D until they all develop rickets.
Sure.
Then you take one of the groups and feed them the test subject and only this test subject.
Hmm.
After a week, you sacrifice a rat and look at the status of their leg bones to see how much the rickets improved.
Yeah.
You can accurately extrapolate the amount of vitamin D in that sample by that
Wow.
test. Now, again, these are somewhat arcane methods. We still do the bacteria analysis. It's still a very useful method because it does analyze the actual nutritional value
Hmm.
of the vitamin. However, largely we do chromatography. HPLC, high performance liquid chromatography, or UPLC, that's ultra high performance liquid chromatography, coupled to usually optical detectors, but
Sure.
not always. UV vis detectors, fluorescence detectors are widely used. More and more, we're seeing tandem mass spectrometers used for the analysis of these vitamins.
Fantastic. And for the most part, we're looking at official or reference methods.
Yes,
Yeah.
yes, especially with infant formula.
Yeah.
Um, the
Do you want to
thing
explain what the difference is
Sure,
between those? Yeah.
absolutely. If you ask me to go create a method for a particular matrix and a particular vitamin, I could probably leave right now and have you results this afternoon. But
Right.
we don't know if it's rugged. We
Hmm.
don't know if it would travel from one matrix to another matrix.
Sure.
We don't know if another chemist could reproduce what I have done. I don't claim to be a great chemist, but I have been doing this for 30 years.
Yeah.
Someone not experienced might not have the same observations that I have. So reference method, when we do infant formulas, we always use reference methods. It is something that has gone through what we call multi-lab collaborative studies,
Hmm.
meaning someone devises a method, a group of experts will review that method to determine its applicability.
Hmm.
Then we get a group of participating labs to do the same samples, and then from there we just statistically analyze results to see if this is a valid, useful method on the infant formulas.
Hmm.
A lot of confidence in these. When something is done with a reference method, we understand that it's a gold standard
Hmm.
method. So for infant formulas, such an important matrix, always reference methods.
Lovely. Okay, so even with reference methods, are we seeing challenges perhaps sometimes
Oh yeah.
with the analysis of
Oh,
vitamins and
vitamins
infant
are
formula?
tough.
Yeah.
Vitamins are really tough. It's funny. A lot of my career was doing contaminant work at
Okay.
very low level, part per trillion
Hmm.
levels, mycotoxins at part per trillion levels. I moved to doing fat soluble vitamins, I think 5 years ago,
Hmm.
and it has been challenging. I thought it would be easy. It
Yeah.
is not. The vitamins are reactive. They're not
Yeah.
stable. Some of them are horribly unstable. Vitamin C, ascorbic acid, very unstable.
Yeah.
A great amount of time has to be done to preserve the vitamin. To make things even more challenging, many of the vitamins, especially the fat soluble, have what we call isomers.
Hmm.
It is the same molecular weight, kind of the same structure, but we'll have twists in the
Yes.
structure, so to speak. We have what we call transformations. You imagine a carbon chain that's roughly in a straight line versus cis, where these carbon chains will have a kink, so to speak, in it. Now, this is important because they do not have the same nutritional value. You can feed them into a machine and you will get the same result.
Right.
But unless you somehow can resolve these geometric different shaped molecules, you cannot give an accurate analyte amount of what is in that sample. To make things even more challenging, we have optical isomers.
Yes.
That's kind of a left hand, right hand configuration. This is important because in a biological setting, only one of those two configurations will be nutritional value. I like to think of a stamped key that you unlock your door with. If you make a mirror image of your key, it's not going to work in the lock. The machine keys does not fit the lock in that case. Same case. Those can be very, very difficult to separate chromatographically. Luckily, we've invested in some technology that can do it. Supercritical fluid is something that can pull these apart. Those are some of the challenges that we see with vitamins.
Yeah. So maybe it's kind of a continuation of that question. What trends do you see coming for
Mm,
vitamin testing?
sure,
I suppose
sure.
some of them will address some of the
Yes,
challenges that you
absolutely.
talked
No,
about.
we are always trying to fight and rectify these challenges. The industry has been very good to try to identify what they would like to see other chemists doing, and of course, we try to achieve that. Some trends I see: more mass spec work.
Sure.
When we use mass spec, we really have a solid confirmation of what that compound is. We in our work almost always use tandem mass specs, meaning that we can detect the vitamin in its intact form and isolate that. However, then we will fragment that in a part of the machine, creating what we call fragment ions.
Hmm.
And when we pair those with the intact ion, we know that that is really the vitamin we're looking for. That's not necessarily the case with some of the optical detectors. You have to have very good chromatography with optical detectors, where we have an element of time associated with the analysis as well as a specific wavelength. So we really prefer the mass spec as the
Hmm.
way to go. They're more difficult to use, they're more complicated, but the benefits are huge. Identification, we can also do the analysis much quicker
Yeah.
because we can do coelutions of of our different compounds. We do not need to resolve them in real time.
Yeah.
So those are the big ways I see going. More robotics.
Okay.
Funny story. Years ago, I did a vitamin K analysis specific method. And there's a technique that we use in the lab called liquid partitions.
Hmm.
Imagine trying to separate water and oil,
Yes.
and you have to vigorously shake the solution to try to transfer fat soluble vitamins into a nonpolar phase. Well, in the lab, I would do this test, and I would go out and I would do the physical shaking of these samples, and somehow I constantly got a few percent lower in our result than a guy who I kind of think was a beanpole, a really skinny little guy. Somehow he was outperforming me, and I
Yeah.
was teased so bad for that. I would like to see more robotics doing this to eliminate some of the variation that we see between different chemists.
Yeah, absolutely. So you touched a little bit about a little bit on robotics, which I know Eurofins is investing in,
Hmm.
but there's some other technologies that Eurofins
Oh,
is
absolutely,
investing in,
absolutely. We're
especially in regards to vitamins.
always pushing. We're always pushing the boundaries of what is out there.
Yeah.
I'll mention a few. There's one project that I've worked on for several years now. It's done. It's in routine use, but not for infant formulas because of the reference method.
Sure.
And that is coupled supercritical fluid extraction and chromatography with tandem aspect detection. In this case, all the solvents that we would use for the analysis of vitamins has been replaced by supercritical carbon dioxide, which shares the properties of a solvent. So very exciting, and it eliminates a lot of the bench labor that our chemists would really use. So again, it's a universal extraction done at high pressures, and it's a good way to get results to our clients a lot faster because we're eliminating some of the workflows. Another project I have been working on is analysis of vitamin B12.
Hmm.
Typically, we have very good methods for infant formula, but there's some interest in differentiating some of the pseudo vitamin B12s and the other forms of vitamin B12. The big one is cyano, but there's also methyl hydroxy. We are exploring the use of coupled HPLC with ICP mass spec to analyze the compound by detecting the cobalt atom that
Okay.
resides in vitamin B12. Very exciting. That's probably going to be a lot of the time in the lab for me in the next few months. Then finally, there's a new class of mass specs are out there that utilize something we call ion mobility.
Hmm.
Remember, I was talking about the cis trans
Yes.
isomers? They're geometrically different shapes, and they can be pulled apart in a charge field. I think it'd be fantastic to eliminate the need for chromatography altogether. I think it'd be fantastic to have our runtimes not be 10 minutes, but have them be 30 seconds.
Right.
That's the way I see some of our new techniques going in the future.
And then do you think, what would it take for us to have those new methods applied on infant formula?
Sure. No, that's gets a little challenging.
Yep.
We can always overcome it. Some of these technologies, we are the pioneers in this.
Sure.
We are the ones pushing the boundaries, and these machines can be complex.
Yep.
They're not cheap. They're quite expensive. So there just simply are not a lot of these machines in the industry to do the collaborative work.
Mhm.
But I think that we could entertain the possibility, and it's quite simple to do. We do groups of analysis on samples and compare them statistically to the regulated methods,
Mhm.
and that should give us a good answer if this is an acceptable way to go.
Yep.
But that is a discussion that we need to have with our management, our quality, and our clients to decide that.
Yeah. So if a client was interested in perhaps trying to use, for example, SFE, SFC
Hmm.
technology
Hmm.
in infant formula, we could perhaps validate their
Yes,
products
absolutely.
on the method.
We
And
absolutely could.
yeah,
Absolutely could. Actually, when we validated that method, we did use a certified reference material infant
okay,
formula for it. So we know it works very well for the A vitamins
yeah,
and the E vitamins, and it works quite well for vitamin K. Vitamin D we cannot do yet.
okay,
Possibly with modifications we could, but vitamin D is quite low in abundance. The structure of vitamin D is very much like cholesterol, which is so prevalent in nature
yes,
that we don't have the selectivity yet to do it. I think there's always a possible way to get there, but we could not do vitamin D at this point.
okay.
But the others, yes, we certainly could do.
Very interesting. That's
Hmm.
awesome. Well, thanks so much for coming to
Thank you.
the podcast, Dan. It's been a great conversation. Vitamins is it's a huge topic for infant formula.
Of
It's
course.
a big component, and I'm really grateful for you sharing your expertise.
No, thanks for the questions. It was a good
Absolutely,
conversation.
absolutely. Thanks so
Thank
much,
you.
Dan. Thanks.